Hello, and welcome to the AHA Team Trainings video on TeamSTEPPS for COVID-19 during this crisis. This video will feature a TeamSTEPPS tool called CUS. Before we begin, I'd like to introduce myself. My name is Dr. Kevin Crane. I'm a nephrologist and the Vice Dean for Academic Affairs at Tulane University School of Medicine. In this video, we'll briefly educate you on the TeamSTEPPS tool itself and also talk about how it can be applied during this particularly critical time in healthcare. First, we need to really have a shared mental model on what TeamSTEPPS is. TeamSTEPPS is a set of team strategies and tools to enhance performance and patient safety. And more importantly, it's an evidence-based set of tools that have been designed to help healthcare professionals improve patient safety and quality, primarily through effective communication and teamwork skills. AHA Team Training is the leader in providing TeamSTEPPS education at a national level and providing support to that field. TeamSTEPPS is particularly helpful, and during this time, more than ever, we need to ensure the safety of our patients and our community throughout the entire COVID crisis and learn skills that will help us in healthcare in general. So let's start by talking about mutual support. The CUS tool that we're featuring is one of the 4 anchoring principles of TeamSTEPPS, mutual support. Mutual support, which is commonly referred to as patient care backup, is critical to team performance and patient safety. Mutual support involves team members working together with a shared mental model of whatever the task is at hand that makes sure that they, first of all, assist each other, they provide and receive feedback, and equally as important, they exert assertive and advocacy behaviors when patients or those with COVID create potential concerns for the team member's safety or other patient safety. Mutual support is really the essence of teamwork. And for example, in a healthcare environment, one team member's work overload or oversight may result even in fatal consequences. And mutual support provides the safety net that helps prevent errors, increases effectiveness, and minimizes the strain that's caused by the work overload. Particularly at this time, given the volume of patients and the stresses involved with care of patients with COVID-19, this is particularly important. Over time, this continuous mutual support fosters team adaptability, mutual trust, and team orientation. The CUS tool is used particularly in relation to periods when someone really needs to speak up about a concern. And there are many barriers that occur in healthcare and in general that prevent people from speaking up at times when the little voice in their head says there's a problem and I need to say something, but they're really concerned about it. Certainly hierarchy is a major concern in healthcare. As I like to tell people, the military, airline pilots, and many other industries have figured out how to break down that hierarchy to ensure the safety of their community and the people that they're taking care of. And certainly in healthcare, we can do that. So the CUS tool is designed to help us address this particularly significant problem so every member of the team, all the way down to people who are not sometimes doing direct patient care, feel comfortable with bringing up issues that are of concern for patient safety or the safety of those around them. We should never make assumptions. We all realize that, so paying attention and never assume people know exactly everything that's going on. And other times people are worried about being wrong, but it's better to be wrong and express a concern and work with a team that can address that. Even inexperienced members of the team will see things and address issues, as we'll show in a moment, that may seem small but are particularly important to patient care and the safety around. And finally, there's always conflict. And in medical care, conflict sometimes is good. It brings in new opinions and new approaches and gives an opportunity for people to discuss that. So conflict is not necessarily bad. People should also not be defensive when somebody brings up a concern that they hadn't realized. And we all get caught with conventional thinking and assuming things are the same. And then finally, the issue of repercussions is a big one. And as mutual support improves and increases, then everybody realizes that speaking up is particularly important to the whole team, and there should never be an issue of repercussion. So let's get very practical and talk about a scenario that many of you might find sounds familiar. So the first scenario is that of a tired ICU attending, not unusual in these days, leaving your recently created COVID-19 unit, something that is occurring across the country, and is not removing her PPE correctly. As a respiratory therapist covering that area, you notice that she's not following your unit's protocol. What are the appropriate actions to take? Remembering that this is a concern not just in this situation for the patient's safety and the safety of other patients, this is also a concern about our healthcare workers who we must vigilantly protect during this period. So as you might expect, the respiratory therapist says something about a concern about the PPE, expressing politely. The attending disagrees there's a problem and proceeds to continue without following protocol. I say this in that it does not reflect on the attending because we're dealing with someone who's tired, under pressure, and just because somebody disagrees doesn't mean this isn't an outstanding attending. We all have lapses in our behaviors at times for a variety of reasons, and this may equally have been the case. So in this situation, it's very important to address what to do. Now it's time to CUS. So what is CUS? It's the mnemonic that expresses three pieces of the communication tool, which is I'm concerned, I'm uncomfortable, and this is a safety issue. So it's an advocacy tool that provides the language that helps break down hierarchy and many of the other barriers we just talked about to address just this situation, remembering that all members of the team are empowered to CUS because it's all about the patient, it's about your healthcare team, it's not about the individual. In this setting, the use of CUS would be, excuse me, Dr. Smith, I know you must be very tired and exhausted, but when I saw you taking off your PPE, I'm concerned you did not follow our protocol of, and again, most institutions now have very strict protocols regarding PPE, putting it on, taking it off. Might get a response such as, I'm sure I did it properly. I really have to go do my documentation and go get some rest. So it's not unusual for people to be a little bit defensive. And when that happens, the appropriate response would be, I can appreciate that, and I know you've been doing an incredible amount of work, but I'm uncomfortable knowing that you did not follow our unit's protocol and would ask that you please do so and repeat the procedure the appropriate way. Follow-up response might be, really? Yes, Dr. Smith, this is a safety issue, not just for all patients, but for you and all of us. Let's just get this done the right way. I'm happy to help you. And what you hope you hear at the end is the famous, thank you, I really am pretty tired, but let's get this done the right way. This type of approach can be applied in the most basic forms, whether people wash their hands, don't wash their hands, use in the operating room, for a variety of circumstances. But now more than ever, we really need to be able to address the concerns of people speaking up, working as a team, and making sure that we protect everybody. And by the way, listening to what's happening in our hospitals across America, I've never heard so many people talk about teamwork as effectively as they have, and this is a great time to use these tools to reinforce what we do and improve and ensure that, again, everybody is protected. So what are the key issues in actually using CUS? Well, there's several of them. First of all, it's a great way to communicate by addressing the traditional barriers that we just talked about. Second of all, the focus is always on the patient and in our current environment, the entire team itself. So it's never about criticizing the individual, and it's always important to emphasize that point and make sure that people don't think that they're being attacked or criticized unduly. It's always about the patient and it's about the team. When teaching this tool to the staff, always have your learners imagine that the care that they're involved with involves one of their loved ones. What would they do themselves if they saw something doing something that was unsafe in the care of one of their family members, one of their loved ones? And most people right away say, well, I would speak up. Well, again, we want to treat all patients as if they were our family or loved ones, and so we need to speak up as a result. So, because everybody would speak up if the safety of their family member is at stake, we should think about it no differently than for our patients. And finally, this is a great tool to use when someone doesn't wash or clean their hands, particularly in this concerned era of PPEs and the importance we place on the barriers to prevent infection across ourselves and with others. So during this pandemic, it's essential to use not only with hand washing, but in following all protocols that protect patients and healthcare workers. So in conclusion, I hope this very short video gives you the opportunity to learn about CUS, how it can be applied in situations that are never more important than they are currently. The HA Team Training team is here to support you during this crisis and for all of your future patient safety and quality improvement needs. Feel free to get in touch with the team should you need any additional assistance or resources, and that information is provided on this slide. Thank you very much. It's been a pleasure having the opportunity to talk with you.